It's quite a bit. Okay, for your appendicular skeleton, that's 126 bones. That is divided into the upper extremities and the lower extremities. So that's the next chapter. So that would be the appendicular. Okay, so your pectoral girdle consists of your clavicle and scapula. The clavicle, and this is on page 143 in my book. The clavicle is your collarbone. It's basically an S-shaped bone on its side, kind of. It's a little bit like an S. There are structures associated to it, but I'm not going to hold you responsible. So again, use what I have on the handouts for what you need to study. So for the clavicle, if you see it on the exam, it would just name it. So that's the clavicle. The scapula, that's your shoulder blade. That does have quite a few structures. Let's see if we have one here. No, that was the one that's attached. Oh, there's no skulls in there? Oh, okay, so what happened to all the skulls? Oh, here, I guess.
That was trans.
Yeah, there is definitely but there's so scapula. No, that's the disarticulated one. That one.
As if I do my lab is wrong. What's that term?
Are you taking orgo?
The angle that was some
Upton?
How to spell
I have
S-H-A-T?
I have Upton.
You have Upton? When do you have?
I have orgo 1.
Found a couple of goodies.
When do you have?
Tuesday, Wednesday?
That was the Oracle
Yeah,
body
2 days.
and
Okay, so here,
last one.
and you're going
What's
to,
your brother's name?
when we're done with this, you can take boxes back to your table and try to do it on your own and point them out to me. Just make sure you know what you're doing. Okay,
Yeah.
the scapula. Here's your scapula. Okay, it's your shoulder blade. That's the one that goes back here. So it has the triangular body. So if I have a sticker on here, that would be the triangular body. There's also the acromion. So let's see. Well, it's the opposite one that you have here. But see this little ledge here? That's this. That's the acromion. So if I have a sticker on there, it would be the acromion. That articulates with the clavicle. So again, if this were the correct one, they would articulate
I have a
together.
question.
Yes.
On the exam, like, if you show like a structure of a bone and we write, instead of clavicle, we write collarbone, is it?
I might take a point off. Depends.
Oh, she likes you.
I want the scientific name.
She don't like you in the point.
Oh, okay. The glenoid fossa, or fossa means cavity. So glenoid fossa or glenoid cavity is here. That's going to accept the head of the uterus, the shoulder arm. So they're showing it in here, this diagram here. So what I would do is all the structures and bones I have on the handout, maybe highlight what's on here so you know exactly what to look at. So that accepts your humerus, the head of the humerus. That's your ball and socket joint. That's the socket. The ball would be the head of the humerus, which we'll get to.
What's the ball made out of? Cartilage?
Which one?
What's the ball made out of? Cartilage?
No, the ball is
This?
here.
Oh, okay.
That's bone.
Oh,
So
okay.
that's spongy bone. This is real, by the way. See the spongy bone? The holes in it? That's a student that asked too many questions. That's the
That's
student
like-
that put the common
Collarbone.
names on.
See some big bones.
It's real.
Is that from a adult or a small child?
Yeah.
It's adult.
Former anatomy teacher. Okay, so what do you need to know on here? That it's the scapula. Here's the triangular body. Here's the acromion. Here's the glenoid fossa or cavity. Now there are other structures, the coracoid process. Oh, I forgot one.
Spine.
Sorry, the spine, which is here. The spine as well. So if I don't mention it, if it's not on the handout, like I'm not going to ask you the coracoid process. So if it's not on the handout, then don't worry about it. Okay. So the triangular body, the glenoid fossa or cavity, the acromion, and here's the spine. This is the spine here. Okay. And then it's the scapula. Okay, for the arm, the upper arm is the humerus. This is the head. Now, these projections here are the tubercles. They attach your scapular muscles. So it should be on the next page. The bigger one is called the greater tubercle. That would be from here to here. So this is the greater tubercle. And then see this small little projection here? That's the lesser tubercle. So you have the head, you have the greater tubercle, and the lesser tubercle. Okay, so you need to know those. Then you have the shaft, right? Now here is where those annoying terms are going to be a pain in the neck. Remember you thought you were done with lateral and medial. Well, if this is the head, this is going to face like this, right? The head always faces medial. It goes to your socket joint. So this is the head. Here are your two epicondyles. So which one would this be and which one would this be?
That'd be
This is what?
right.
Medial.
Medial.
No.
And the other's left.
Because again, this is towards the midline, and this one would be lateral. So the medial epicondyle is in line with the head. So the medial epicondyle is in line with the head. The lateral one is to the side. I'm not going to ask you, is this a right or left humerus? I'm not going to do that, okay? But you do need to know medial versus lateral. Okay, so on the humerus, it's either identify the bone, so this would be the humerus, or it could be the following structures: the head, the greater tubercle, the lesser tubercle, the shaft, the medial epicondyle, or the lateral epicondyle. So that's what you need for the humerus. For the forearm, okay, and again, when possible, I will have them separate. See, you thought I was nice, but I'm not. So this and this are the same. Okay, so the one with the flat head is the radius. So see, it says there are two of them. It has a flat head, it rotates, so that is the radius. So you could see on the next page, the head of the radius. So this is your radius. So for that, it would be probably name the bone, which would be radius. So if I have a structure here, that would be the head of the radius, because that's the only two things I have there. Now, back in the olden days, this was probably a spoon that they used to use, because that'll be the way you remember it. This is your ulna. This is your elbow joint, basically. So this would go like this. So this is your hinge joint, remember? The hinge joint. So for the ulna, do you see this big projection here? That's the olecranon process right here. The little notch is the trochlear notch. And that's basically it. So name it, it's the ulnar. It looks like that little thing with the, it looks like a spoon. The olecranon process or the trochlear notch. So this is your elbow, basically. So what you feel here is the olecranon process. Trochlear notch is attaching to the humerus. See? And it goes like that. Okay? Alrighty, so radius and the head of the radius, ulnar, and it's the olecranon process and the trochlear notch. So those would be what you need to know for that.